In the early 1940s, a troubling chapter of medical history unfolded in Guatemala. This is the story of a controversial syphilis study that raised ethical questions still relevant today. Under the guise of public health, U.S. researchers sought to understand the effects of syphilis and other sexually transmitted diseases. But their methods would spark outrage and demand for accountability. From 1946 to 1948, a U.S. government-sponsored experiment involved deliberately infecting Guatemalan prisoners, soldiers, and mental health patients with syphilis, gonorrhea, and chancroid. Victims of the study were often unaware of the true nature of the experiments. Many were treated with penicillin, but only after they had already been infected. Despite the clear ethical breaches, the study continued. It wasn't until the early 2000s that its existence came to light, triggering global condemnation. In 2010, when details of the study were revealed, it ignited a firestorm of outrage. Activists, scholars, and governments demanded accountability for the actions of those involved.
The study was a gross violation of human rights. We must ensure that such abuses are never repeated.
In the aftermath, the United States government issued an apology. Efforts to rebuild trust and improve healthcare in Guatemala have become a priority. In the aftermath, the United States government issued an apology. Efforts to rebuild trust and improve healthcare in Guatemala have become a priority. Today, the focus is on ethical research practices and informed consent, ensuring that the voices of those affected are heard and respected. As we reflect on this dark chapter, we must remember, history teaches us that ethics in research are not just guidelines but essential principles that protect human dignity.